This is Dr. Martorell, and I'm going to be discussing genital herpes. And the reason I chose that topic is because I got so many questions after I did the oral labial herpes talk a week ago. So genital herpes is caused by a virus, usually the herpes simplex virus type 2. It can also be caused by herpes simplex virus type 1, which is the cause of oral herpes or oral sores or cold sores, which is in the mouth and lips. For most people, the first episode is the most severe, and symptoms tend to be more severe in women than men. Signs usually include painful blisters. Usually, these blisters will heal over a few weeks, 2 to 3 weeks, and they will form crust over the area. Besides the blisters, people may also develop tender, swollen lymph nodes in the groin, flu-like symptoms, joint pain, fever, headache. It may be painful to urinate. Some people may also be at risk of developing proctitis, which is inflammation of the rectum or anus, and it is associated with anal sex. Some people may develop only one episode. Some people may develop recurrent episodes. Recurrent episode may travel when the nerve travels from the nerves to the skin surface, and then it causes an outbreak of the ulcers. So there is a likelihood of recurrence. Genital herpes recurs frequently in people, especially in those with herpes simplex virus type 2. It is possible to have a recurrence a few years after the initial infection or outbreak. This type of delayed herpes outbreak can be especially distressing if the person never had symptoms during the initial infection or before, because that person could then worry about sexual activities of the past or present partners. As many as 50% of people with a recurrent outbreak will experience symptoms before those ulcers develop. This is called a prodromal symptom, and they may include itching, tingling, or pain in the buttocks, legs, hips, or elsewhere. The triggers for a recurrent herpes infection include illness, steroid use, stress, sunlight, fatigue, and other triggers. For example, in women, the menstrual period may trigger an outbreak. So when did the person get infected? It is hard to know. The first time a person has noticeable signs or symptoms of herpes may not be that initial first episode. It is possible to be infected for the first time, have few or no symptoms, and then have a recurrent outbreak with noticeable symptoms several years after. For this reason, it is often difficult to determine exactly when that first initial infection occurred, especially if the person has had more than one sexual partner. The current sexual partner may not necessarily be the source of the infection. So, genital herpes diagnosis. It is important to distinguish genital herpes from other sexually transmitted infections, particularly those that may cause genital ulcers, such as syphilis or chancroid, among others. There are several diagnostic tests that the provider may use. It could be a PCR test or a culture test. Those are more sensitive for identifying a herpes virus in the secretions from the urinary or genital tracts. In the case of a culture, if it is negative, it does not always exclude a herpes infection. And then there is also a blood test that identifies antibodies against herpes 2 or herpes 1 or both. The blood test is not recommended in people who have no symptoms. This blood test can detect antibodies infected with the virus at some point in the past. it will not differentiate a new infection from a previous infection. So these blood tests can be helpful for couples if one person has a history of genital herpes and the other one does not. If the partner has not been infected, then it is important for that partner to go on treatment to prevent acquiring the infection. Determining also the type of herpes, whether it's type 1 or type 2, can also help predict the likelihood of future recurrences. Type 2 is associated with more frequency or recurrences than type 1. So transmission between sexual partners. The herpes virus is most often transmitted between partners during oral, anal, or vaginal sex. It is also important that the person understands that they can also develop genital herpes after exposure to a cold sore of an infected person's lip during oral sex, and this could happen even if the person has HSV type 1 or herpes type 1 infection. It is also important to know that transmission from person to person can occur even if there are no visible ulcers. There is the concept of shedding. Now, herpes cannot be transmitted with exposures to environmental surfaces. For example, no transmission will occur with doorknobs, toilet seats, or bed sheets. The risk of acquiring herpes infection increases depending on the number of sex partners that the person has had, how often the person has sexual activity, and avoiding the use of condom use. If condom use is used, there is a decreased chance of acquiring infection. So spreading the virus. The risk of spreading infection is much greater when a person has signs or symptoms of active infection. However, it is possible to spread the infection even when no ulcers are present. So genital herpes and HIV. Individuals with genital herpes are at an increased risk of acquiring HIV. Genital herpes treatment. There is no cure for herpes. The infection can be controlled and treated with antiviral, drug therapy, and self-care measures. Antivirals. There are at least 3 antivirals available for the treatment of herpes: acyclovir, famciclovir, and valacyclovir. They are usually taken by mouth. These antivirals can be taken with any episode or recurrent episode. Episodic treatment means that the person takes the antiviral when they have an active flare-up or an active herpes infection. It's recommended when that person has fewer than 6 outbreaks per year. Episodic treatment with antivirals can decrease the duration and the severity of the illness by hours or days. Suppressive therapy. Suppressive therapy is the same antiviral therapy that is taken every day to prevent outbreaks. Suppressive treatment will decrease the severity and frequency of outbreaks, and the indication is for people who may have more than 6 outbreaks per year. Suppressive therapy can also be an option if the person is in a sexual relationship with a partner who does not have a history of genital herpes. There are studies with valacyclovir that show that taking suppressive treatment on a daily basis can reduce the chances of transmitting the virus by 1/2. So in terms of counseling and support, the diagnosis of genital herpes can cause feelings of shame, fear, and distress. It is important to remember that genital herpes can be managed. So in terms of prevention, using a latex condom with every sexual encounter can reduce the risk of herpes transmission. Even when a person has no blisters or ulcers, the use of a condom is recommended. And sexual activity should be avoided anytime genital ulcers are present, including oral ulcers.